Okay, does anybody else have any questions on chapter 1? All right, so let's go ahead and start with chapter 2. This chapter 2 is the surface anatomy. So we're going to go ahead and start applying some of those terms that we just talked about. Does everybody have chapter 2 open? Anybody not able to get chapter 2 open? Okay, so let's go ahead and start then. So we're going to learn about the surface anatomy, the surface being the superficial parts of your head and neck. Your surface anatomy, you have 12 regions of your head and neck that we're going to cover here. We're going to cover mostly just the outer surfaces today. What I want you to do is right now is if you have the ability to look in a mirror. If not, if you can see yourself close enough on your little screen on the bottom, you can look at your own face while you're doing this. It makes it easier and a little bit more fun to try and locate these structures on your own face. So we're going to start with your course objectives. Your course objectives are to define the key terms and anatomic terms, discuss how the surface anatomy of the face and neck may impact dental clinical procedures, locate and identify the regions and associated surface landmarks, correctly complete the review questions and activities, and integrate an understanding of surface anatomy into the clinical practice of dental procedures. So as we're learning about the surface anatomy, you're going to learn in Professor Ramos's class how to do an extraoral exam. And so what you're going to do when you learn to do the extraoral exam is you're going to actually palpate these areas on a patient. And you're going to look for any kind of abnormalities on their face. So again, most everybody's face is going to be within normal limits. But if you see something like a mole or a lesion somewhere on their head, you just want to make a note in your clinical notes that the patient has this. Now, we're not going to have you mark every freckle they have or anything like that. But if you see something that jumps out at you as being potentially a problem for the patient down the road, like some big scaly looking lesion on the top of their head, something where they maybe can't look at it every day, you'll definitely want to point it out to the patient and let them know. If the patient is bald and they have something on the back of their scalp and they're a lesion of some kind, you'll want to point that out to them because they aren't looking at the back of their head, and we don't know if any family member is looking at the back of their head, or they just assume that the patient must know it's there. It's on their head. So let's go ahead and start. The surface anatomy is the study of the structural relationships of the external features of the body to the internal organs and parts. Features provide essential landmarks for many of the deeper anatomical structures. So as we look at the surface anatomy, on some of these things, I'll point out what is located underneath them, because some of the parts of your surface or your face have something underneath that's important. We're going to visualize and palpate to see if there's any abnormalities, and any changes noted must be recorded in the patient's record. So patient records are super, super important. Just going to lead in with that right now because you're going to start learning how to do clinical notes, and we have templates for the clinical notes. You probably saw them yesterday in Dentrix, right? Those of you who are in clinic saw them in Dentrix. And so making sure you document everything is extremely important. I know sometimes it seems like it might get a little tedious to have to document all these things, but it's so important. And it definitely could save you or a patient someday if something goes south on you. Regions of the head. So there are 12 different regions of the head. So we have the frontal region, which is right here, which is considered around your forehead. We have the parietal region, which is these two up on the top, and there's a suture in between them. Both of those bones are the parietal region. Your occipital region is the back of your lower back part of your head. Your temporal region is where your temples are on the sides of your head. The auricular region is located around your ear area, so it includes the whole ear area. The orbital includes the whole eye area. And then your nasal, your whole nose area. Then you have your infraorbital, and if you look at the picture on slide 5, your infraorbital is like right below the orbital. So infra being inferior, so it's going to be below. And then your zygomatic is your cheek area. Those are your cheekbones. And then the buccal is located where your fatty part of your cheeks are, down at the bottom, that loose kind of fatty. And then the oral would be around your mouth. And then the mental region is located, if you look at that picture, where's the mental region on there? It's your chin area. So it's kind of, that area is kind of not really as obvious as some of the others. But the mental region is your chin area. Was everybody able to find those on their own head? Because when we get in class on Mondays and Wednesdays, we'll be finding all these areas. So you have in your frontal region, where your forehead area is the area that's above or superior to your eyes. So you can always already see how we're going to start applying that terminology from chapter 1. You have your supraorbital ridge, which is inferior or below your eyebrow. So if you take your fingers and you touch the area around your eye, you're going to feel the ridge right as it goes below your eyebrow. You can feel that ridge. And then you've got your frontal eminence. Your frontal eminence, if you take your fingers and you just slide them across your forehead, you can kind of feel where it sticks up a little bit, kind of right in the center, is your frontal eminence. And that's where you get your temperature taken when we're taking your temperature in clinic, is right in the center of your forehead. And an eminence like projects out a little bit. So it's kind of hard to feel, but it kind of sticks out just a little bit right there. And then your glabella is the smooth elevated area between your eyebrows. So it's this area right across here. It's where we don't want those stray eyebrows. So it's right between your eyebrows and it's smooth. Okay. Then in your parietal and occipital regions, we really don't have anything that we pay specific attention to on those areas. Just know that the parietal bones are the two on the top that are met with the suture, and your occipitals like your lower back region. So if you put your fingers toward the back of your head, you can feel your occipital region, and it actually sticks out some right there as you come around down your head. So the parietal bones and the frontal bone meet in a little triangular area. So there's a suture that goes down the middle of your head, like where you part your hair or would part your hair if you're parting it in the middle. And then there's a suture that joins the frontal bone to those two parietal bones. And when we study the skull, we will study that a little more closely. That little area where those three bones meet on you, if you touch right up there where those three bones would meet, is hard. It's part of your skull. But if any of you have been around children or have children of your own, those sutures are not closed when you're an infant, and that's where the soft spot on a baby is located. You know how they say the baby has a soft spot? It's right where those sutures join, but the sutures aren't closed yet or fused together on an infant. That's why you have to be so careful of their head too. Okay, so that's your parietal and your occipital, and then we have your temporal and auricular regions. Those are the sides of your head. So your auricular region contains your external ear, and so now we're going to, if you can see your ears at all, we're going to talk about the parts of your ears. You have your helix, which is your free marginal tissue of the ear and ends with the earlobe. So if you look at your ear, that's that marginal area that's kind of loose. It's hard, but it's kind of loose, and it contains your earlobe. And then your auricle, or oval flap of the ear, and the external acoustic meatus. So the auricle, or oval flap of the ear, and the external acoustic meatus. So the external acoustic meatus is the hole that goes into your ear. And then you have your tragus, which is a smaller flap of tissue of the auricle anterior to the external acoustic meatus. So if you take your finger and you touch the hole where your ear is, and then just anterior or in front of the external acoustic meatus is your tragus. And you can see it on that picture on slide 8, but it's that kind of hard thing. And then your antitragus is the other flap of tissue opposite the tragus. So it's the other, or the back side of the hole that goes to your ear. And then the intertragic notch is between the tragus and the antitragus and is a deep notch. So you kind of have to feel hard for that. And you can kind of see it right in that picture. And then you've got your orbit, or your eye area. And the orbit itself is the bone, or the bony socket where your eye sits in. So your bony socket where your eye sits is much bigger than your eye itself, or the part that you see of your eye, I should say. Around your orbit, you have your lateral canthus. So lateral, do we remember what lateral is? Anybody? So lateral is away from the midline. So that way would be your lateral. So your lateral canthus is on the outer part of your eye. Those would be your laterals. And then your medial canthus is closer to the midline. So your medial would be the inner corners of your eyes. And then you have your sclera, which is the white area of your eye. So you see a lot of that. Your sclera of your eye actually kind of has a different shade, like kind of like teeth have different shades. And they kind of tend to darken a little bit as you get older. So if you look at a small child and they open their eyes, they have big, bright, white eyes. Then if you go home and you look at your grandmother or your great-grandmother, theirs is not quite as white and bright as a child's eyes. And then you have your lacrimal gland, which produces lacrimal fluid or tears. So your lacrimal glands are located on the outer surface of your eye. So right above your lateral canthus, up in here, are your lacrimal glands that produce tears. And then we've got your nose, or your nasal region. So where the root of your nose is between the eyes. So your root of your nose is right here. And think of like a plant. The root of the plant is the base of it, and the root of your nose is the same thing. It's the base, and then your nose projects out from there. Your nasion, which 9 times out of 10, if you're typing the word nasion, it's going to change, your spell check will change it to nation. Just so you know, if you ever see nation on any of my documents, it's supposed to be nasion, but spell check doesn't like that word. Is inferior to the glabella, and it's a midpoint landmark of the nasal region that corresponds with the junction between the underlying bones. So it's right here. And when we get into the skull next week, you'll see that your nasal bone, your nasal passage is actually 2 bones. And there's a suture that joins those 2 bones. And the nasion is the external marker of those 2 bones meeting. Let's see, then the bridge of the nose is the bony structure inferior to the nasion. So we've got the bridge of the nose. And then the apex is the tip of the nose. So you can wiggle your apex. Your nares, or nares, when they're plural, are the nostrils inferior to the apex on each side of the nose. And then your nasal septum separates the nares. So you've got your nares, which are the holes, and your nasal septum. And then these outer flaps that stick out on the sides of your nose are your ala. And down on slide 11 is a picture of all those little areas. Okay, and then you've got your infraorbital or below your eye region, your zygomatic or your cheek, and your buccal regions located on the facial of the head. So underneath in your buccal region, the buccal region is mostly soft fatty tissue and it covers muscles. So when you are a young person, and if you ever noticed babies have such chubby cheeks because they have a lot of buccal fat, buccal tissue in there. As you continue to age, you lose, that tissue starts to break down, just like everything else is breaking down. Your base starts to break down the tissue, and you get more of a shape to your face. That happens over time, and it happens at a different rate on everybody. And that's why, you'll see adult people with still pretty chubby cheeks, and you see sometimes teenagers who have virtually no buccal pads in there. It's just the amount of fat in that tissue in that area. So your infraorbital region is located inferior to the orbital region and lateral to the nose. So lateral being on the sides of the nose, the outer sides. So your zygomatic region is even farther laterally, so we're going to continue to go outward or laterally, and contains the zygomatic arch. So you can feel your zygomatic arch under there, your cheekbones. Your TMJ, so most of you are probably familiar with that term TMJ. Has anybody not heard the term TMJ? So your TMJ is where your mandible and your skull or your temporal bone meet. And so if you take your fingers and lay them right next to your ears, anterior or in front of your ears, and open and close, you can feel your TMJ. Now, for some people, that TMJ grinds or pops or does some abnormal things, which you'll learn more about down the road here. But that's where your mandible and your temporal bone meet. And we're going to pay a lot of attention to the TMJ. Your oral region contains the lips, the oral cavity, the palate, the tongue, the floor of the mouth, and parts of the throat. This is our biggie here. This is what we're zeroing in on here. So you have your vermilion border or zone, which is a darker appearance and outlines the lips. And then your mucocutaneous junction outlines the lips and is transition zone from the surrounding skin. So the mucocutaneous junction is like a line that outlines the lips. And if you look at that picture on slide 13 really closely, you can kind of see the darker line on this person. It's not always that prominent. This, of course, is a picture for a textbook. It's not always textbook perfect. So sometimes those zones just all sort of blend. Now, if we have something on an identification on a midterm or a final on that, I will make sure it's a clear picture like this. And just so you know, when you take your practical exams or anything like I give you for a test or anything, they're going to be really obvious. Like, I'm not picking things that are, doctor level stuff. They're going to be pretty obvious that you can identify them without any problem. Your philtrum is that vertical groove superior to the midline of the upper lip. So if you look at your upper lip and they kind of come together and there's those two lines and it dips in the center, that's your philtrum. And then your labial commissures are the upper and lower lips meet at each corner of the mouth. So these are your labial commissures, the corners of your mouth. And those are important because when we talk about muscles in chapter 4, your muscles move your labial commissures. That's how you can smile or grimace or frown, is through those muscles moving that labial commissure. And then you have your nasolabial sulcus or nasolabial groove. So the groove running upward between each labial commissure and each ala of the nose. So if you look at your face, and right here from your ala down here, there's kind of a little indentation, and that's your nasolabial sulcus. And in the center of it would be the groove, but that dip inside is the sulcus. And so that too, when you're young, is not as prominent as it is when you get older. Because as you get older and you lose some of this fat in your cheeks and your skin starts to kind of droop a little bit, those sulcus and grooves become more prominent. So now they do a lot of those injections, the gel injections and stuff, to puff those back out because it makes your face look younger. And it's easier than doing a facelift. And then your nasolabial folds are on each side of the nasolabial sulcus are the folds, and that's what ages when you, or shows more when you age. The mental region, you only have a couple of things. Your labiomental groove separates the upper lip from the chin. I'm sorry, the lower lip from the chin. So your mental labiomental groove is right here, and you can actually feel that. In fact, when you stick your lip out, you can really feel it. And then your mental protuberance is your chin, and sometimes you can have a dimple. And why do you have a dimple in your chin sometimes? The midline depression that marks the underlying bony fusion of the upper jaw. Lower. I don't know why I keep saying upper. So you have your mandible has two bones that fuse together at a very early age. And so sometimes you can get a dimple right there where they fuse. And so that's why people have dimples sometimes. And if you'll notice when we're going through this, if you look at the terms, they kind of describe their location. So labial would be lip, mental would be the mental area or the chin area. So going between your lip and your chin is your labiomental groove. So same with like your nasolabial sulcus, goes from your nose or your nasal area to your lip. So they're kind of named after each other. So sometimes even if you're not sure what we're looking at, you can kind of figure it out just based on breaking down the words. Then you have your oral cavity. This is the part we really are excited about. This is what we want to learn. Your facial or labial structures are closest to the facial surface or the lips. So facial comes from closest to the facial surface, or labial closer to the lips. Now we use the term facial when we're talking about teeth. We use the term facial are the surfaces that face the front of your body or the outer part, but labial is only used if they're for the anterior teeth. So your labial surfaces are only on your anterior teeth. And then we have your buccal, our facial surfaces closest to the inner cheek. So when we're talking about teeth and we're talking about the buccal, we're talking about your molar teeth because those surfaces face your cheeks. And like I said, facial can be used interchangeably for either the anterior or the posterior teeth. Lingual are structures closest to the tongue. That's an easy to remember. And palatal are structures closest to the palate. So when you're talking about teeth, if you're talking about the insides of your upper teeth, you can use either term lingual or palatal. It doesn't matter, they're interchangeable. But when you're talking about your lower, you only have lingual to choose from because you don't have your palates on your upper. Does anybody have any questions so far on what we're talking about or what we're looking at? Okay, because we'll look at these. Oh, okay, your mic's not on.
Can you hear me? Is it on now?
It is now, yes.
Okay. When we're like trying to learn all these terms, what has been like a good way to do that, like for other students, I guess?
Well, I have, there's a PowerPoint that's uploaded to Canvas, and it's kind of set up like a flashcard kind of thing where I'll have the definition and some choices, multiple choices, and then the next slide will have the answers. So what I've seen some students do is print those, and then they actually will put them on like note cards, just cut them and glue them onto note cards.
Okay.
Or you can rewrite them all if that is a learning way for you, because some people will learn it better if they actually have to write it out. So the more times you can look at it and write it and read it, the more it'll stick to you.
Okay.
And then you can have, if you have a study buddy in mind or anything, you can quiz each other on them and stuff, set up something like that. If not, you can always, if you have anybody in your house that will quiz you on them, you can ask them to help you with this. Then they feel more actively participating in your education if there's somebody that that will help you with this. Okay. So does anybody know who this is in the picture? Who is it?
Luke Bryan.
Luke Bryan, yep. I had another one that has Patrick Mahomes in it, but I uploaded this one today. Underlying the upper lip is the upper jaw or maxilla. And then underlying the lower lip or the lower jaw is called the mandible. So you've got your maxilla or maxillary when you're describing something, your maxillary teeth, your maxillary lip, and then you've got your mandible. And you can remember that because the TMJ is the temporal bone and the mandible. So the temporal mandibular joint is what TMJ stands for. Okay, and then you've got your labial mucosa, which lines the inner parts of the lips and is pink and thick. So the inner parts of your lips. So if you roll your lip out like this, you can see the inner part of your lip. That's your labial mucosa. So anytime we use the term labial, we're going to mean lip. So we're going to be talking about anterior areas. And anterior teeth run from canine to canine. So we're going to be talking about this area right here if we're using the term labial. So your labial mucosa is on the insides of your lips, and you can feel it with your tongue. It's very soft and smooth. And then you have your buccal mucosa, which lines the inner parts of your cheek, and it's pink and thick. So if you take your tongue and you rub your cheek, you can feel how smooth your buccal mucosa is. Those two, the inner mucosa, the labial mucosa, and the buccal mucosa just blend into each other. So if you take your tongue and you rub it from front to back, there's no division there. It's just like a continuous flow. Your alveolar mucosa lines each vestibule and meets the labial or buccal mucosa at the mucobuccal fold. So this one's a little trickier. Your alveolar mucosa lines each vestibule. Your vestibules are, if you take your tongue and you go all the way up to the top as far as it'll go in your mouth, that's your vestibule. It's kind of like the little where it rounds over. So your teeth are here and your gum tissues, or your, not gum tissue, your mucosa's here, and it comes up right here, and this is your gums and your teeth. It's that arched area. It's the big arch up there. The mucobuccal fold is very important for us to know down the road, because that's where you're going to give injections. And then the parotid papilla is the inner part of the buccal mucosa just opposite the maxillary second molar. It's a small elevation of tissue that protects the duct opening from the parotid gland. So this one you can see on people. You'll be able to see it pretty much on yourself. Normally in class I have would have you put gloves on and you will retract your cheek and look at it. But since we're not in class and we don't have gloves, and I don't want to encourage you to stick your hands in your mouth. But maybe later on when you're in front of the bathroom mirror and washing your hands, pull your lip back, and right above your second molar, or your very back molar, is a little flap of tissue. And it protects your parotid gland. Your parotid salivary glands are up here. And that's where the duct comes and releases saliva into your mouth. And that's an important thing for us as hygienists. Number one, we sometimes confuse it with pathology. So some people have really big flaps of tissue, and we look at that and we go, oh my gosh, there's something wrong here. But it's not, it's normal. It protects the gland. The other reason we need to know about that is because calculus tends to, and plaque tend to build up heavier where your salivary glands are. So when your salivary glands are depositing saliva right between your first and second molars, that's a place where a patient's going to have a lot of calculus usually, is right up in the top. Anybody have any questions about that? Okay. Your maxilla, on your maxilla is an elevation on the posterior aspect of the maxilla, just posterior to the most distal molar is the maxillary tuberosity. So if you take your tongue and you put your tongue back behind your last molar, if you can do that, you will feel a hard piece of tissue right there. That is your maxillary tuberosity. It is behind the last molar. So if you don't have a wisdom tooth, it's going to be behind your second molar. If you have a wisdom tooth, it's going to be behind the wisdom tooth. So once the wisdom tooth comes out, the maxillary tuberosity is now behind the second molar. Some people have a very prominent one, some people don't. Oftentimes when your wisdom teeth are impacted, they're right there where the maxillary tuberosity is, so you can feel it and it's big and it's hard. But if they've had their wisdom teeth out, a lot of times it's just pretty flat because the tissue sunk in when the teeth came out. On the oral vestibules, the upper and lower, again, the vestibules are those, the area where it arches upward and you take your tongue and you can rub up in your vestibule, are spaces between the cheeks, lips, and gingival tissues. So the vestibular fornix is the deepest part of the vestibule. So if you were to take your lower lip and pull it out, the very bottom part, as deep as it'll go, is your vestibular fornix. And that's important because, again, like you said, when we're giving injections and stuff, that's where we're aiming. It's right in that area. It's pretty soft tissue. It's very vascular, so it bleeds pretty easily. And then your labial frenum, or frena, if it's plural, are the folds of tissue between the midline, between the labial mucosa and the alveolar mucosa on both the maxilla and the mandibular. So if you pull your lip out or up, it's that string of tissue you see. Those are your labial frenums. And that's what helps hold the tissue to the teeth. Some of you may not have a labial frenum because they may have removed it for orthodontic purposes. The labial frenums on both the top and the bottom are supposed to be positioned in a certain spot through birth. If they are not, if they're down too low and they come all the way down to where the teeth are, they will cause your front teeth to do this because they're pulling or tugging on the tissue, and they'll cause your front teeth to do this. So if you ever, when you were a child, or if you're around a child and their front teeth are spaced apart like this, it's because their labial frenum is making their teeth spread apart. So that what they would do is they go in, the dentist will go in, and now they do it with a laser. They used to do it with a scalpel, but they will go in and they'll like break those frenum attachments so that they stop pulling the teeth apart, so the orthodontist can pull them together and they stay together. So when we get into perio next term, we'll learn a lot more about what frenum attachments can do to your teeth and how to fix them. But some of you may have had that done when you were younger for orthodontic purposes. Your face is divided into 3 different areas, or thirds. They are not equally divided thirds, though. And this is called your vertical dimension of the face. So from an aesthetic purpose, you have something called golden proportions, which are a set of guidelines for the vertical dimension of your face. And so this is just kind of a sort of a cosmetic standard of how your face should be, divided into thirds and the different regions. Your teeth and your jaws are located within the upper and lower jaws of the oral cavity. So the teeth of the maxilla are called your maxillary teeth, or your upper teeth. The teeth in the mandible are your mandibular teeth, or your lower teeth. Both of the dental arches, so the upper is a dental arch, are called the upper arch. The lower is a dental arch, called the lower arch. Both of your dental arches in the adult have permanent teeth that include the incisors, canines, premolars, and molars. We will learn a whole bunch about all those different teeth as we go through this class, but there are 4 divisions: incisors, canines, premolars, and molars. Children do not have premolars, so your primary dentition does not have premolars, but your adult dentition does. You have anterior teeth. So where do you think your anterior teeth are located? In the front of your mouth. And your posterior teeth would be in the back of your mouth, yes. Surrounding both the maxillary and mandibular teeth are the gums or gingiva, composed of pink, firm oral mucosa. So if you smile, you will see your gums. They should be pink. They should look firm. I'm sure they do. They should look just like this mouth does right here. And your gums are a complicated little area here. So we've got different parts of your gums. We've got your attached gingiva. So if you look at your teeth, and we're going to look at all of this when we have our little meetings on Mondays and Wednesdays. So all of you will have a chance. We're going to look at these on ourselves in the classroom and stuff. We'll have gloves, we'll have hand sanitizer, but you'll just be touching yourself anyway. But your gum tissue is divided into different layers, and the layers go from the teeth on up. So you've got your attached gingiva, is the gingiva that tightly adheres to the bone around the roots of the teeth. Your attached gingiva is the part that you touch, that's like surrounds your teeth. It's hard, it's pink, usually a light pink. Your marginal gingiva or free gingiva is right along where the tooth and the gum meet. So your gingival margins are those scalloped areas that make the McDonald's arches over your teeth. That's your gingival margin. Your gingival sulcus is the inner surface of the margin. So your tooth sits here, and your marginal gingiva sits right here, and your sulcus is this little space between the tooth and the marginal gingiva. That's called your sulcus. Okay, so that's a little space between 2 structures. Just like this was your nasolabial sulcus, it's the dip down or the space between the 2 folds. It's the same thing. This is where you're going to be doing all of your instrumentation, is between your gingiva and your tooth. So all of your instrumentation is going to be in that little area. And you're going to be measuring that little area and how deep it is with your probes. So one of the first instruments you're going to learn to use in Professor Ramos's class is your probe. And that's the area you're going to be measuring, because there should be a certain amount of space in that area that's considered normal or healthy. Then you've got your interdental gingiva or interdental papilla. So your interdental gingiva or papilla are those little triangle pieces that come down between your teeth. And then your mucogingival junction is the line between the firm attached gingiva and your soft alveolar mucosa. And we'll do this when we are in our little lab, but if you pull your lip out, you'll actually see a pretty drastic color switch between this nice pink, hard, firm attached gingiva and where it comes into your softer lip area. And that little line is called your mucogingival junction. So in other words, it's where your mucosa and your gingiva meet. It's the junction. And again, if you dissect your words, you can kind of come up with a definition. Your hard palate is the roof of your mouth. It's the firm, hard part of the roof of your mouth. You also have a soft palate, which is closer toward the back of your throat. Your soft palate is soft. If you palpate your soft palate, it's kind of softer, squishy. If you palpate your hard palate, it's hard. You have something called an incisive papilla, which is that little spot that gets really inflamed when you drink or eat something hot. It's right between your two front teeth. You can touch it with your tongue. It varies in size on everybody. It's natural size, not even considering burning or anything like that. But everybody's papilla is different. And so, but they're all just variations of normal. So as you look in each other's mouths and then look in patients' mouths down the road, you will see all these variations. That incisive papilla is a marker for something that's underneath that's going to become very important in your life here. You have palatine rugae, which is directly posterior to this papilla, and it's firm, irregular ridges of tissue. So if you take your tongue and you rub them on those ridges, those are called your palatine rugae. They're those rough ridges. And then you have a median palatine raphe, and that's the median ridge that runs along your hard palate all the way back. And it goes back through your soft palate. You just can't feel it that well. But on your hard palate, you can feel it really well. And it's like right up in the middle of your hard palate. And again, it marks something that's underneath that we'll learn when we get to the skull next week. It's more prominent on some people than others, but they're all just variations of normal. So if you look at somebody, some people it might be really dark. Other people it just sort of blends. Your uvula is that little thing that sits down in the center of your throat. It's actually a muscular structure. And then here's some new terms that are going to be a little bit harder to remember. Your pterygomandibular fold. So if you look at that picture on slide 26, your pterygomandibular fold is going to run from the upper to the lower, and it forms kind of almost like an arch. And we will look at this more closely when we get into class, because you really kind of need to look at this. You can Google pictures, images of it, and you'll see different images. It's an important landmark, so we want to know that we can find it in your mouth and in other mouths. So we'll work on that when we are in our little lab next week. But you'll also, you can look at them in clinic when you're starting to work on each other. It's an important landmark because it's where you're going to do one of your injections. And then you have your retromolar pad. So we talked about your maxillary tuberosity, which was behind your very last upper tooth, right? It's in the maxilla, your maxillary tuberosity. Your mandibular, your retromolar pad is on your mandibular. It's behind your very back lower tooth. And so if you touch it, it's that smooth pad that's right behind your last molar. Those are two terms you will become very familiar with, but don't get them mixed up. I can't tell you how many times on a quiz I will ask a question about a smooth, firm, and I'll say in the upper arch, and someone will put retromolar pad. But keep them separate. Maxillary tuberosity is on the maxillary, retromolar pad is on the mandible. But they're basically the same structure. The body of the tongue. So if you stuck out your tongue, the body of your tongue is your anterior 2/3 of your tongue, and including the apex. So it's most of your tongue that you're going to see. When you stick out your tongue, most of what you're sticking out is the body of your tongue. The base of your tongue is the back third. And so as you probably know from probably previous anatomy classes, is that base of your tongue goes back pretty far. So when you're sticking out your tongue, you're really mostly seeing the body of your tongue. The base of your tongue is way back there. You have a dorsal and a ventral surface. So your dorsal surface is the top of your tongue. The ventral surface is the underneath side of your tongue. And then you have small elevations all over called lingual papilla, or small elevated structures. So when you look at your tongue, you're going to see all these little elevations on them. They are called lingual papilla. There are 4 different types of lingual papilla, and these 4 different types we're going to learn, and they're very important. So this next slide, on slide 28, we have the different papilla of the tongue. So we're going to start with the bigger structures. Your sulcus terminalis is the V-shaped sulcus or groove that separates the body from the base of the tongue. So that's an easy way to know whether you're sticking out just the base of your tongue or the body of your tongue, because there's this, it's a very prominent V shape. When you get a chance, go look in the mirror at your tongue and see if you can find these structures. Your foramen cecum is where the sulcus terminalis points back toward your throat. So this is a V shape that goes back like this. And the foramen cecum is the little indentation that's right in the center of where that arrow pointing to the back of your throat is. And then you have your median lingual sulcus, which is the top surface or dorsal surface of your tongue and has a midline depression. So if you, again, it's a sulcus, so it's kind of like a depression or like a valley. It's a sulcus, and it runs right down the center of the tongue. It's more prominent on some people. It's hardly noticeable on others, but it's still variations of normal. Some people have what looks like a crack or a river running down the center, but again, still within normal limits. You have the 4 different types of papilla. You have filiform, fungiform, and circumvallate, and then you have your filiform, fungiform, I left one off. Oh, foliate. It's probably on a different slide. So you have your filiform, fungiform, circumvallate, and foliate. So your filiform are slender thread-like lingual papilla. Your fungiform are like mushroom-shaped. So that one's easy. Think of a fungus and mushrooms. And then your circumvallate lingual papilla, there aren't very many of them, and they run just along the anterior side of the sulcus terminalis. And so this, I know this seems like a lot of stuff, but when you get a chance and you go back and you look at these pictures, just kind of look at where these things are. We're going to go over them several times. They're going to be in your handouts and your work you're going to do at home. So the more you see it, the more you'll remember them. So don't feel overwhelmed right now with all this terminology. I know it seems a little overwhelming, but believe it or not, you'll pick up on it really quickly. Because like in a matter of just a couple weeks, you'll look back and go, I can't believe I struggled with that. And it's funny to hear students as they're studying for the midterm during like week 4, they'll be like, I can't believe how hard that seemed at the time. Now it's like no big deal, you know, but at the time it seems kind of hard. So just hang in there. So the underside or ventral surface of the tongue is noted for its visibly large blood vessels or lingual veins. So when you look underneath your tongue, it's kind of scary looking. There are so many veins underneath your tongue. And the older you get, the more prominent those veins become. So if you have an elderly patient, when you get in clinic and you start seeing patients and they lift up their tongue, it's like scary looking. But it's because there's so many veins in there. But think how much a tongue bleeds, and think how much a tongue hurts when you bite it. But tongues bleed so much because they're so vascular. There's so much blood supply to your tongue. Your lips are the same way; they bleed a whole bunch. This plicaea oh gosh, this one's hard to say. Plicaea fimbriata are finger-like projections. So if you lift up your tongue, you're going to see these two kind of thicker lines. Somebody have a question? No? Okay. You also have a lingual frenum. So just like we said, you have labial frenums where you pull it out. If you lift your tongue up, there's one of those little straight, little stringy things underneath. That's your lingual frenum, lingual being tongue. You have sublingual folds on the sides, and you have a sublingual caruncle. If you lift up your tongue and you look underneath your tongue, there's two little like round structures, and that's your sublingual caruncle. It's the openings to your salivary glands under your tongue. So your main salivary glands, or your major salivary glands, are the ones up here and the ones under your tongue. So we said when the ones up here flow, they form a lot of plaque and calculus. So what do you think happens to the bottom two? Plaque and calculus on the lower anterior teeth. You will almost always, even on each other, you probably already have some. So when you get into clinic and you start cleaning each other's teeth and practicing your instruments, you might have a little bit that your clinic partner can scale off of you. So, because that's a very common place to get calculus. It's hard to brush. You know, you kind of have to do weird things with your toothbrush. Patients, sometimes you'll see calculus all the way up to the tops of the teeth on the back. It's a pretty cool experience. I know it sounds weird, but you'll fall into that category pretty soon, where calculus is considered really fun. Okay, and then we go down the throat. You have your pharynx. Your pharynx is divided into three parts: your nasopharynx, your oropharynx, and your laryngopharynx. They're easy to remember because your nasopharynx comes back from your nose. Your oropharynx comes below that from your mouth. And then your laryngopharynx is your throat. And that's exactly, and then your epiglottis is cartilage behind the base of your tongue. As far as your oropharynx, that's the part we really care about because that's the part that pertains to your mouth where we're looking. You have openings from your oral region into your oropharynx. Those are called. Sorry, did somebody have a question? No? Okay. They're called fossas. They're openings. And the fossas are formed literally on each side of your mouth, and you can see those. We'll look at these when we get into class, into your lab part of your class. So don't worry about looking back in your throat. If you do get curious and you're in the bathroom and you're looking in the mirror at your tongue and you want to look at your throat too, that would be cool. Just open your mouth really wide and you'll be able to see these folds of tissue that go back. So just look at them. There's going to be two like really prominent pieces on each side, and those are the anterior and the posterior. The anterior would be the one closer to the front. The posterior would be the one behind it. And in between them are your palatine tonsils. So you have lingual tonsils that sit at the base of your tongue, and then you have palatine tonsils that sit in those two folds. And your palatine tonsils are the ones that you hear people a lot of times have removed. And then the regions of your neck is divided into cervical triangles. And these are the areas of the regions of your neck. You have your sternocleidomastoid muscle. So if you take your hand and you feel down your neck, There's a thick muscle, like right here. That's your sternocleidomastoid muscle. And when we get into the muscles, we'll learn where exactly it attaches on both areas. But it's a big, thick muscle. And so if you're looking at the areas divided into triangles, you've got your sternocleidomastoid muscle is one big, and then you've got your, I'm drawing a blank, trapezius muscle. So these are the different triangles. And if you look at those, you can kind of see where they're divided, but your sternocleidomastoid muscle divides the neck. And your submental, and remember we said your chin was considered your mental region, right? Submental would be down here. So right underneath your chin. And you take your fingers and you feel down here, it's kind of squishy soft between the bones of your jaw. So right down here, it's that's your submental region, or sub being below the mental region. And back here, if you take your fingers and stuff and feel like underneath your molars, that's your submandibular area. So submandibular, submental. You have glands in those areas. You have lymph nodes in those areas. So I think next week when Professor Ramos teaches you how to do extraoral exams, you're going to palpate those areas, feeling for lymph nodes. Those lymph nodes that are in those two triangular areas are where, like if you have infection in your mouth, it's where you would get swollen lymph nodes. So when you're palpating on a patient and you feel swollen lymph nodes, that means that something in there is draining into those nodes. Now, it could just be that they have allergies and their throat is draining some phlegm, or it could be that they have an infected tooth somewhere and it's draining into those nodes. But if you feel nodes that are swollen, you just want to make a little mental note of that so that when you get inside the mouth, you can kind of look around and make sure you don't see anything. When we study the chapter on lymph nodes, we'll get more into detail about which teeth drain into which nodes. So that if you feel a swollen node, you kind of know which teeth you might want to look at, because different teeth drain into different places. And so you have your thyroid. You have your thyroid cartilage, you have your hyoid bone. Your hyoid bone is a little horseshoe-shaped bone that sits kind of attached to cartilage. It doesn't attach to another bone. It just kind of sits there and is attached by your thyroid cartilage. And your larynx or your vocal cords are ligaments that are attached to your thyroid cartilage. So that's a lot of information, okay? What I want you to do then is go into Canvas and look at the handouts and stuff that I posted in Canvas and make sure you can open them. So you have to access it through modules. And if you look, you see lecture 1.1, July 28th, and those are all of your handouts and assignments that are associated with these two chapters. So if you click on the review terms, chapter 1, about halfway down, and you'll notice the little F in parentheses, so that's going to be the head and neck anatomy book. And if you open that PowerPoint, you can see that what I was talking about, where I have the definition and then some choices, and the next slide has the answers. So you can kind of use that to quiz yourself. And I did the same thing for chapter 2. So you've got some quiz things you can play around with on chapter 2. Then below that is your assignment. Oh, that one says assignment. This is just for you to go through when you're reading your chapter, because most of you probably haven't read the chapter. Maybe you skimmed it last night, but you can go through and fill out this study guide. It is not due for a grade. So that will help you, again, if you read it and write it, that helps you when you go back through to write it all out. And then you've got a worksheet.
You said that was the assignment one?
So the assignment one, it's not even on here. Well, where it says assignment 1.
Right.
That's the assignment. So if you notice where it says assignment 1, there's a due date underneath it. The rest of them don't have due dates, right? Because the rest of them are not due. Those are just for you to do for your own learning experience. The one that says assignment 1 says August 4, 59 points underneath it. Do you see that?
Yes.
Okay, so that's the one that's going to be due. I would probably start with playing around with some of these other things and then go back and do that, because some of it might make more sense.
Which one were you referring to whenever you said to go through that while you were reading the chapters?
What? I'm sorry, I couldn't hear you. What?
Which one were you referring to when you said to fill it out as you were reading the chapter?
It's the one that says, well, there's a couple of them. One that says the assignment 2. Let me see. Hold on. I'll tell you exactly where they are located here. The one that says Chapter 2F ID location terms is the one that I said to go through and fill that out like while you're reading the chapter. And then the other one that says worksheet is another one you can use to fill out while you're reading the chapter, or you can try and fill that one out on your own afterward if you feel like testing yourself or whatever. The answers to that one are right below it. So if you want to fill it out and then check yourself, you can check yourself with the answers. Now, the one that says assignment 1 is an actual homework assignment for a grade, so the answers are not posted for that one. And you don't have to do them in this order. You can mix them up however you want to. You don't even have to do them. Like I said, they're kind of there for your benefit to go through those. But hopefully the more you see it and the more you read it, the more you write it, the more you'll learn it. And it does work because, like I said, at midterm, everybody's kind of like, wow, I can't believe I was struggling with that. And then the assignment, like I said, is not due for a week. So you have a whole week to work on it.
So I went ahead and opened the assignment just to see what it looked like. And I opened up the Word document with it as well. Those numbers are kind of all over the place. Can we edit it to where it says like slide 1 and then number it from there?
Yes, I don't know why it uploaded that way, because when I typed it, it wasn't all over the place. But yes, yes, if you want to straighten them, and it might be that if you downloaded it like to Word to your computer, it would straighten them, because they were straight on mine. I don't know why they did that, but yes, if it doesn't, you can go ahead and straighten them out.
Okay. Okay.
In fact, it would be nice if they were straightened out. It'd be easier to look at.
Deal.
Hopefully your other Word documents open up okay. So is everybody able to see and access all of those things? Is anybody having trouble getting them open or have questions about what to do?
I have a question.
Okay.
For the answer sheet, is it okay? Like if we printed it, wrote it, typing, is that okay too?
Yeah, just as long as you upload it back to Canvas, because you can upload. Do you know how to upload stuff to Canvas?
Yeah.
Okay, yeah, you can go ahead and print it. I know some people said they like stuff printed better.
Yeah.
The answer sheet, you can print it and you can answer it and then just upload it back, or you can type a new answer sheet, just upload it. Just make sure when you're writing the answers, put the letter and the word if you're going to do both,
Okay.
so that it's easier to grade than the letter. But on the other stuff, the worksheets and stuff, you can print all those if it's better for you to have them down next to you writing instead of typing them in. That's perfectly, you can do however you want to do those. And then hopefully seeing and writing these will help you to remember some better. There are some, on the back of your head and neck anatomy book, there are some cardboard card things that you can tear out and separate. Does everybody have their book handy?
Is it this one?
Yes, yes. And in the very back, if you open up the back, there's cardboard like tear out cards. And there's one right there for the regions of the head. And you can go ahead and fill those out too, or use them to study.
I think back here. Which one do you have in your hand? Sorry, I forgot I'm on mute.
It's the Illustrated Anatomy of the Head and Neck. Did you find it?
Mm-hmm.
And then flip to the very back, and there's those cards in the back. Does anybody else have any questions?
Are we going to use this book too for this class?
I'm sorry, what? Yes, that's going to be the Thursday book.
Okay.
That's your dental anatomy book. So on Thursday, you will need that book.
Okay.
And on Thursday, when you are looking at that book, the first chapter on Thursday hits some of these areas again, like the terminology. So you'll talk a little bit about, some of them will be overlapping. And so that might help you too when you're reading that chapter if you kind of looked over more of this stuff. And Professor Bowles just texted me and said to remind you guys that your meeting time is 10:30 this morning for her class. Did everybody? Okay. I think everybody's still on. So 10:30 this morning for Professor Bowles.
I have a question.
Uh-huh.
Are you going to want us to bring our books to that lab that we meet with on Mondays?
Yes, yes. Bring your textbooks with you and bring like anything you might want to take notes. If you have stuff that, did I lose you here? Oh, there you go. Bring paper or whatever you want to take notes, or if you have questions on something that you're not sure of, you can write them down and we'll address them there. If you think of something while you're doing these assignments or these homework things and you decide, you want something explained further, that's the time for us to do that. We'll be in small groups of 6, so it'll be a little bit easier to get more one-on-one instruction on these, which is actually even better than the way we did it in the classroom, because in the classroom there were all 24 of you. And when it came to like showing you stuff on models, I had to kind of hop through all 24 of you. So this way you get a little bit more individual time. So that's the time. Bring those questions with you. I'll be glad to, and I'm going to show you all these things like today, like we did, only we're going to be doing them up close and on ourselves. I'll have mirrors and stuff for you to look at yourself. And if you want to bring your phone, I'm sure most of you keep your phone with you for the flashlight. That's kind of handy because
Okay.
It's kind of dark in your mouth.
Thank you.
All right. Everybody,
What time do we meet on Wednesday?
I'm sorry,
for-
what?
What time do we meet on Wednesday for this class?
One of the groups is going to be, so not everybody meets on Wednesday. This team meeting, your next class is Thursday from 8 to 10.
But in person, what time do we meet?
What group are you in?
I'll be tomorrow.
So
A2.
tomorrow morning or afternoon?
Afternoon.
So you meet from 12:30 to 1:30.
Okay.
Okay. And then you have, I guess, radiography lab afterward?
Yep.
Okay. Yep, that's kind of how it was supposed to work out. All right. Does anybody have anything else? Feel free to email me if you have any questions or concerns. Take a deep breath. This is going great. You're going to do fine. We'll have a chance to go over all of this. So just be ready for radiography. She's ready for you next. And
I just have one quick question.
uh-huh.
On the schedules, I only have for tomorrow a preclinic lab and a radiology lab.
Did you have me yesterday?
No. If I did, I wasn't there.
Okay. So what group are you in? A1?
I'm in A2.
A2. So yesterday I had A1 and B2.
Okay.
Right? So tomorrow we'll have A2 and B1. Does that sound right to everybody?
And
Okay.
what time? You said that's 12:30 or?
They added in that extra hour.
Yeah, they gave us a new schedule.
Okay, I see.
Okay.
They gave
Do
us
you have the new schedule?
Obviously not, but I'll have to like get on there and print it out. So
Yeah, if look in your emails because it probably maybe one of your classmates knows what day it was emailed. If they can
Yeah.
find the email and just forward it to you so that you'll have it. But one of the groups meets tomorrow from 10:30 to 11:30, and the other group is from 12:30 to 1:30.
Okay.
So depending if you're supposed to be in radiography in the morning, you'll be there from 10:30 to 11:30. If you're supposed to have radiography in the afternoon, you'll be there from 12:30 to 1:30.
Okay, great.
Did anybody find that email?
I think I
They
just
gave
wrote
it
mine
to
down.
us. They gave it to us the day we had CPR.
Okay.
Oh, that makes sense. So I wasn't there for that. Okay.
If you want to, who am I talking to?
Miranda Tackett.
Okay, Miranda, if you want to email Director Beckerly, I'm sure she can just email one to you.
Okay, no problem.
And then that way you have it.
All right,
You
thank
did
you.
email as well.
But I'm guessing A2 was supposed to be in the morning. Does that sound right? Anybody in A2 group?
It'll be afternoon. A2 will be in the afternoon.
You're in
Yeah.
the afternoon? Okay.
Mhm.
So just email Director Beckerly and I'm sure she'll send one to you. Anybody else have any questions? Well, if you do, feel free to email me and I'll be at school today from noon to 7. So I'll check my email a few times during the day so that if you have any questions, I can get them answered for you, okay? Otherwise, have a good afternoon.
Thank you. Thank you.
Thank
You're
you.
welcome. See some of you tomorrow.
Bye.
Bye.